Let our online students also punch the answers. We have a very good crowd from Tirupati, Guntur, Dr. Arundhati, Reshma, etc. etc. Very good. What do you see in TBM, doctor? Classical question. Huh? TBM, okay, except C, B, B for beggar or D for doctor? RBC count you want to say? Question number 2. Reshma is proposing low chloride. Who said a high RBC count? Loud clap to Karthik. So, Tirupati also said D. So, all forms of meningitis, doctor, CSF findings you must know. Simple to remember. Pyogenic meningitis. Staphylococcus, do they eat sugar? They eat sugar. So, CSF may low sugar. Do they lead to exudates other places? Exudates have a high protein. CSF has a high protein. They will also lead to pleocytosis. Simple. Then, viral meningitis. Will viruses require glucose? No. So, normal glucose is viral meningitis. Then what is TBM? Raised protein, low sugar like bacterial meningitis. Additionally, chloride content. Okay. Then, pyogenic meningitis, what do you have, doctor? Shoot an answer. A, high protein, low sugar. In meningitis, you see all this except meningitis. Nishant, where is Nishant? We are missing Nishant. Prasad, bolo. What is your answer? Huh? C. C? That's right. You find seizures, ICT rise, subdural effusions in which type of meningitis? H influenza meningitis may. Viral encephalitis, which is not a common cause. Yeah, what do you like to say? A, C, Nipah virus. Nipah virus. Raju. Question number 5. Guntur is proposing cytomegalovirus. Cytomegalovirus, Nipah virus which you don't know, CMV which you know, they all lead to viral encephalitis. But what is the rule? HSV1 is above the belly involving brain. HSV2 is below the belly involving genitals. Is a classical point which you should not forget. Young male develops fever, headache, confusion, focal seizures, frontotemporally hyperintense lesion is found on MRI. Frontotemporally, very important clue. What is the most likely possibility if you find bilateral frontotemporal hyperintense lesions? Guess, Madhav. Deepaka, what is your name, doctor? Karthik. Come on, Karthik. See here. See. You please show the placard. That is another way, parliamentary way of answering. Yeah, we want to say, yeah. What is your answer? Come on, come on. Remember, any elderly woman who comes with altered sensorium, finding frontotemporal pathology is an important feature, which is a feature of HSV encephalitis, is what need to be remembered. Now, yeah, commonest presentation of neurocysticercosis is what? Commonest presentation. Very good. Seizures. Give one big clap, doctor. Your name, doctor? Amrita, please loud clap, loud clap. Lot of times a patient with seizures, when you evaluate, you will discover Neurocysticercosis is what need to be remembered, which is not a prion associated disease. You like to say? Dear? That's right. Alzheimer's is not, at least after all this review. Creutzfeldt's disease, what is except? Creutzfeldt's Jacob. Huh? Some guess? See? You want to see myoclonus is not rarely seen but often seen. Right? D you said, no, brain biopsy is needed for prion. What is the brain biopsy finding in a prion disease? Wo bolo. Spongiform encephalopathy it is called as. Excellent, doctor. 30-year-old complains loss of erection. Low testosterone, high prolactin. What is the diagnosis? You like to say pituitary adenoma, which is prolactin producing? Beautiful. That's right. Von Hippel-Lindau. Where do you find vascular anomaly? Cerebellar hemangioblastomas are a part of the von Hippel-Lindau syndrome. A child has flaccid paralysis, which is ascending type, with albuminocytologic dissociation. Come on. Huh? That's right. What is your diagnosis? Guillain-Barre syndrome. Do you use steroids? No. We use IV immunoglobulins is what need to be remembered. That's good. Neuropathies can have predominant motor involvement. So what is except about it? Which is not a neuropathy with a predominant motor involvement. What is the other type of involvement? Sensory. One more involvement, mixed. Wo bolo. You know what to read now in textbook. Neuropathies which show predominant motor versus neuropathies that show predominant sensory. A lamba list will be hanging. Which part of memory it is called? Declarative memory or declarative memory? Which type of memory? Purely facts. Come on, tell me, what is your answer? You like to say? B for boy. D for dog, arsenic. Very good. Please do one big clap. Arsenic is which type? Come on. Sensory? In fact, it is sensory motor. And no problem. Something is good. Some guess went right. Some stone was pelted correctly. All are ascending motor except. You want to say diabetes is answer I am listening. Any other answer? D? B. Deepak is saying diphtheria. Karthik is saying diphtheria. Karthik is in full testosterone speak. Please do one big clap, doctor. That's good. So Karthik is very sure. What is ascending? Descending paralysis. What is the ascending paralysis? You remember? Porphyrias, Guillain-Barre, diabetes. All these are ascending type. Which is a cause of reversible dementia? Come on, Karthik, shoot. Huh? Yes? Arey, lecture sunne ke baad bhi nahi answer kare to? Or you want to say that is the reason I am unable to answer? Yeah. B, A also. Huh? Excellent. Please give big clap. What is subacute combined degeneration due to? Vitamin B12. अगर vitamin B12 दे दिए तो patient will once more singing the old romantic songs for his wife. I still remember one of the patient, Niranjan. He was a school teacher and a strict wagon and a very good prolific writer. and his wife in fact brought all the beautiful songs he has written, and the earlier those about 10 years back there was no recording in phone and carrying the songs, but she was completely upset. Niranjan is unable to sing, Niranjan is unable to dance, unable to walk. What happened to him, doctor? She was crying. You get a serum vitamin B12 level, you discover the vitamin B12 is low, and you give him a vitamin B12 injection. Niranjan once more sings, once more talks, and while going home he will thank you, and lifelong he will remember that egg is a vegetarian, that milk is vegetarian. If you go to Calcutta, fish is also vegetarian. You go to China, chicken is also vegetarian. Is what you have to tell your strict vegan who is suffering from vitamin B12 deficiency. That's the reason what he must tell the God, oh my God, bless this universe, I am in Beijing, let me eat. And he has to eat thinking that he is a Beijing citizen, because in Beijing chicken is a vegetarian. So you need to be quite sure. And why it is called subacute combined degeneration, don't forget, due to dorsal column which is sensory, corticospinal tract which is motor, both of them got degenerated in that, hence you call it as combined subacute degeneration of the spinal cord. Why do you get LMN features like areflexia in them? Because vitamin B12 deficiency lead to demyelination of peripheral nerves. Peripheral nerves are the part of the LMN, and LMN feature is areflexia. Why do they have Babinski positivity? Babinski is a feature of UMN, corticospinal tract involvement, and since that got demyelination in vitamin B12 deficiency, they have Babinski like UMN, areflexia like LMN due to peripheral neuropathy is what you need to remember. Now doctor, what are the most sensitive tests to diagnose myasthenia gravis? You like to say? C. Positive edrophonium test. That is the only test that we know about myasthenia, I believe. Okay doctor. What will edrophonium will do? Oh batao. Superb. It is an anticholinesterase. It is a cholinesterase inhibitor or anticholinesterase inhibitor? Huh? It is a acetylcholinesterase inhibitor, doctor. है ना? Because it inhibits the acetylcholinesterase. Acetylcholine cannot be broken down. So acetylcholine levels in NMJ will increase. What is the problem in case of myasthenia gravis? The postsynaptic receptors where acetylcholine goes and binds, they are all autoimmunely destroyed. Very few receptors are there. If the receptors are few, if you increase the acetylcholine levels, even those few receptors can then be occupied by increase in neurotransmitter. If they are occupied, then muscle contracts and neuromuscular function recovers. That is the idea of increasing acetylcholine. So then, with high acetylcholine, even few receptors can be filled. That's the idea. Okay. So what is the answer? Give one big clap with all the story. Positive edrophonium test is what you need to basically remember. That's good. What is correct about Eaton-Lambert? Give an answer, doctor. How many didn't hear about Eaton-Lambert? Eaton-Lambert. Okay, first let me tell what is Eaton-Lambert. सुनने के बाद कम से कम आंसर करना. Simple, doctor. You have a neuromuscular junction. Nerve comes to neuromuscular junction. Synapses release the acetylcholine that jumps into the synapse and goes and binds to the receptors in the neuromuscular junction. Then the muscle contracts. This is called muscle. This is the story. Myasthenia gravis में क्या होता? Autoantibodies will come, right? And they will go and destroy the postsynaptic receptors. So that though the acetylcholine is released when nerve is stimulated, the number of receptors are very sparse. That little neurotransmitter released don't know where to go and bind. Before it goes and looks at where to bind, what will happen? What will happen? Muscle doesn't contract. So muscle weakness is there. That is the story of Myasthenia gravis. In Eaton-Lambert, what will happen? Okay, then one more thing about Myasthenia gravis. If you keep on using your muscle, right, what will happen? Every time neurotransmitter is released, whatever the neurotransmitter is going and binding with the few receptors which are available, right, then the number of receptors which are not yet married, unoccupied, will become further lesser. Originally 1000 postsynaptic receptors are there, doctor. Autoimmune destruction has made that 1000 become 100, right? With every muscle contraction, what happened? Out of that 100, 10 are getting occupied with acetylcholine. After 10th muscle contraction, what happened? What happened? Only 10 receptors available for this to go and bind. It became more sparse. So the problem will worsen with, as you keep on exercising the muscle, the problem become more and more worse because the postsynaptic receptors keep more and more remaining in a bound state. Unbound receptors are becoming less and less available. So what is it called as? Decremental conduction. As you keep on working, the muscle keep on becoming weaker. Now I will tell you other situation. Eaton-Lambert. In Eaton-Lambert, the presynaptic receptors are there, no? There, the neurotransmitter is supposed to get released. For it to get released from the synapse, there are some calcium channels. Unless calcium moves, it doesn't know that to release, right? There are antibodies against those calcium channels on the presynaptic receptors. Because of that, when a nerve impulse comes, what will happen? Neurotransmitter is not released at all, right? But there, if you keep on working, more and more nerve impulses will go, and though the calcium channels are few, still this neurotransmitter gets released. So with more and more work, what happens in Eaton-Lambert? The neurotransmitter release become better and better, and the strength will keep improving. That's called incremental conduction, is a feature of Eaton-Lambert. So Eaton-Lambert is presynaptic voltage gated calcium channels responsible for the release of the neurotransmitter. That you need to remember. Myasthenia gravis is a problem of postsynaptic receptors to which neurotransmitter is supposed to go and bind. If you know this, you know everything. Now give an answer at the end of all this story. Yeah. Give an answer. What is the answer? Array, in spite of all the lecture you answered correctly. Please give big clap. I thought without lecture you can guess correctly. I'm not listening. So that is all about the Eaton-Lambert. That's good. Now Duchenne's muscular dystrophy is a problem of muscles. C is one answer, I am listening. B, sarcolemmal proteins is another answer. Any other answer? Kuch guess maro. D. Question number 18. Guntur says B, Reshma and Bhakti and Arundhati are proposing B and C. Nobody says D. Dystrophin is what, doctor? Sarcolemmal protein it is fundamentally. Okay. So if you answered wrong, be happy. See, when you open Davidson, it will be boring to read Duchenne's muscular dystrophy. But with this experience, what it will be? Oh, that day there was a stupid question asked in a stupid hour, and we stupidly answered that it is not sarcolemmal. Let us check whether it is sarcolemmal or my answer is only correct. enthusiasm is all about reading and learning. No, my job is every day to create some confusion, some enthu. That's the only job. Tell me, doctor, polymyositis. How many of you have not heard this? Raise the hand. Ah, simple, doctor. The name itself says no, inflammation of the muscle. Right? Ho gaya na? Polymyositis. Does not involve which muscle? Is the question. Those who already are in housemanship should answer. Jaiswal, what is your answer? See? Alright, please give another big clap. Jaiswal is not, unless asked you are not giving answers, that's good. Ocular muscle is spared in that. ये तो आप correct answer करना. Migraine खत्म हो गया. हाँ बोलो. B blurring of vision है. C for cat. Cat. Dysphagia. 20. Guntur, Ram, Arundhati, they are all strong about dysphagia. Lock kiya jaye? That's good. Arey, please give another big clap. Dysphagia, correct guess. Why will there be dysphagia in migraine? Blurring of vision, it is classically seen. Huh? So, that's what need to be remembered. Scotoma will be there, no doctor. Scintillating scotoma. Scotoma का मतलब क्या है? Blurring of vision. Delirium, in all this you will see except B. Parkinsonism में there will be no delirium, you thought. It looks reasonable. You like to say? Typhoid में muttering delirium it is called. Patient will be running, throwing everything. Anything? If you give diazepam, where is the energy for dancing and disco, doctor? There will be no delirium. Now, pseudo dementia is a feature of excellence. Some things will come reflexly, no? So that is how he is all about medicine. Endogenous depression. We keep forgetting what questions are asked in exam, what may be asked. And you may remember only questions without answers. Key will be missing. Now, lateral medullary syndrome may, what is not seen? Come on, we already discussed. What passes through lateral medulla? Question number 23. Come on, quick answers. Uday? Come on. Medulla may you have vagus nerve nucleus. Will there be dysphagia? Done. Then hardness, because sympathetic tract is descending down. It will be there. Then proprioception to the body and limbs. Dorsal column, is it passing through lateral medulla or medial medulla? Will there be any nystagmus because of the 8th cranial nerve involvement and cerebellar tracts? It can be, but you don't have contralateral loss of proprioception. Lateral medullary syndrome of Lambert-Eaton is because of which vessel, doctor? Pica, posterior inferior cerebellar artery. वो तो मालूम है ना, जरा जाके पढ़ना. क्लॉट्स में क्या होता, वेबर में क्या होता, Guillain-Barre में क्या होता और medial medullary syndrome में क्या होता. All brainstem syndromes. Tonight, you can read. Neurofibrillary tangles. Alzheimer's, very good. Alzheimer's में what is except? Should an answer? D. Excellent. Which chromosome, doctor? 21 you want to say? Alright, please give another loud clap. We have some छुपे रिश्तुम के जैसे. आपका नाम क्या है डॉक्टर? Sham is completely scintillating answer. Down syndrome patients में there is a presenile dementia. Downs is a problem of chromosome 21. Parkinsonism can occur due to exposure to, this you can easily answer. Exposure to what? A you want to propose? No doctor. B, manganese. MPTP exposure, manganese exposure, etc. Vitamin E deficiency में क्या होता? You like to say hyperkeratosis. Any other answer? Vitamin E is an antioxidant. You require antioxidants to prevent injury to which tissue in our body? Neurological tissue. If neurological dysfunction is there, what do you get? Ataxia. Because vitamin E is a antioxidant is what need to be remembered. Synkinesia. Where do you see doctor? Synkinesia. Synkinesis it is called as. Eckinesis, hyperkinesis, synkinesis. अगर कोई और मसल कंट्रैक्ट हो रहे तो ये मसल भी कंट्रैक्ट होता. Synkinesis. Bell's palsy में doctor. Synkinesis is a feature, right? Then, what is the most common extramedullary intradural tumor? Tomorrow you all read and come. We will discuss spinal cord tumors, chordae equina, conus medullaris, how to differentiate, everything we will read. Just take a chance to read and come. If we read, why to come? Of course, that is there. But we will see whether how much we know and you know. Yeah, jaldi bolo. Remember doctor, simple rule. In the spinal cord, dura will be there, no, just like in brain. Right? Outside the dura, inside the dura. A tumor can be. Accordingly, you have two kinds. What are they? Extradural tumors, intradural. Dura के अंदर क्या है? Spinal cord है. तो tumor can arise from the spinal cord. Then you call intramedullary. And it can arise between the spinal cord and the dura. Then you call extramedullary. So summarize. Tumors are, spinal cord tumors are extradural, intradural. Outside the dura, inside the dura. Inside the dura, you have intramedullary, extramedullary. What are intramedullary tumors? Which are arising directly from the spinal cord. Remember, what is the innermost part of the spinal cord? I mean the entire vertebral canal spinal cord. So inside the spinal cord, a sage is sitting and doing japam. Sage is what? S for syringomyelia. A for astrocytoma, also called glioma, SAG. E for ependymoma. Is most interior tumors. Hence they are all intramedullary tumors. Intramedullary are all what? Intradural. Got it? You have only extradural, intradural. Within intradural you have intramedullary, extramedullary. And intramedullary are sage. What are they? Tell me. Syringomyelia is not a tumor but a lesion in the spinal cord. To complete sage I am telling. Astrocytoma, also called glioma, and ependymoma. Got it doctor? Then what is an extramedullary tumor? Sorry. Extramedullary tumor which is intradural. Something that is arising from dura. Should be between spinal cord and the dura. What can arise from the dura? Meningiomas are all intradural but extramedullary tumors. And what is extramedullary? Outside the, extradural, outside the dura, any metastasis will go and stick outside the dura. So most of the times metastatic tumors are all extradural. Tomorrow we will review all this funda. So what is most common extramedullary intradural tumor? Ye batao jaldi. Meningioma. Now you got it because it is arising from dura. Last question for today's evening. Anterior spinal artery thrombosis में what is unlikely to be involved? So you must know in the spinal cord is a box, doctor. It's a box. If you open the box, there is a base of the box where you put clothes and you put some structures in that lid which you open in the box. In the spinal cord also you have structures posterior, some structures anterior. Anterspinal artery, does it involve posterior? No. So which structure is posterior basically in this? It is also called posterior column. Dorsal columns, what do they carry? Vibration and proprioception. Whereas sphincters, pyramidal tract, pain and temperature, anterolateral spinothalamic tract, they are all anterior structures. If you take the cut section of the spinal cord, so they become involved in the anterspinal artery occlusion, but not dorsal columns. Bas, chalo.